Hi, Assalamualaikum. My name is Muhammad Haikal, and today I'm gonna be talking and explaining about this particular disease called whooping cough. This disease, also known as pertussis, it is a very contagious respiratory illness caused by a type of bacteria called Bordella pertussis. It is also an endemic disease, common among young children with outbreak occur periodically. A marked decline has occurred in incidence and mortality rate during past 4 decades, primarily in a community where an active immunization program are in place and where good sanitation and hygiene practice as well as medical care are available. Next, we're gonna talk about the structure. As you guys know, we already know about the introduction of whooping cough, and then right now we're gonna go through the size. Okay. Bordella pertussis is a gram-negative aerobic pathogenic encapsulated coccobacillus of Venus bordetella and causative agent of pertussis or whooping cough. Okay, so I already put a picture so you guys can see the overview of this bacteria. And then we have a structure next. Bordella pertussis is a small, approximately 0.8 micrometer by 0.4 micrometer rod-shaped coccoid or ovoid gram-negative bacterium that encapsulated and does not produce spore. Also, this bacteria is a strict aerobic. We keep up with the next whooping cough symptoms. Symptoms of whooping cough often include persistent coughing fits followed by a whooping sound when inhaling. Other symptoms may include a runny nose, sneezing, mild fever, and occasional vomiting after coughing. If you suspect whooping cough, it's important to consult with a healthcare professional for accurate diagnosis and appropriate treatment. That's all from me. We move on to our next presenter. Thank you.
Thanks, Haikal, for the introduction. From my side, I will explain to you guys about the transmission of whooping cough. The transmission of whooping cough caused by the bacterial called Bordetella pertussis bacterium. This bacteria primarily occurs to respiratory droplet. When an infected person cough or sneeze, these droplets are released into the air and carrying the pathogen. By poorly ventilated or crowded environment pose an increased risk, as this microscopic particle can linger in the air. Transmission is not only limited to the air alone, it extends to the direct contact through shared utensil or close interaction and indirect contact via contaminated surface. Interrupting this transmission chain is crucial, with vaccination acting as potent measure to provide individual and community-wide protection. Hygiene practices such as regular hand washing and covering cough serve as additional safeguard, collectively contributing to the prevention of whooping cough, transmission, and the promotion of the community health.
Okay, thank you to Haziq. So my name is Muhammad Salahuddin bin Mausli, and I will tell you guys about the impact of pertussis on affected individuals, community, and public health system. So first, we're gonna talk about affected individuals. Pertussis has a negative impact on the health of those who become infected, especially to infants and young children. In this vulnerable population, the disease can cause severe respiratory distress, which is characterized by a prolonged coughing accompanied by a distinct whooping sound as they struggle to breathe. These episodes can be exhausting and leading to complications like pneumonia, apnea, or even death, especially in infants under the age of 1 year old. So, pertussis can have a long-term effect after the acute phase of the illness. Even after recovery, people may have persistent coughing for weeks or even months, disrupting their daily activities and lowering their quality of life. This persistent cough can be especially distressing for adults, interfering with work, social interaction, and overall well-being. Next is impact pertussis on communities. Pertussis outbreak can disrupt entire communities, causing fear and concern among parents, caregiver, and healthcare provider. As you can see behind me, these are cases chart of pertussis. For your information, many of the confirmed cases of pertussis were either too young for the pertussis vaccine or didn't receive sufficient doses of the vaccine for their age. Now, for the death cases is even more tragic. The fact that up until August 2023, there have been 24 victims of pertussis who have died, and 19 of them are children who were younger than 5 months old. This is the highest pertussis mortality rate since 2011, exceeding pertussis mortality in 2018, where 19 out of the 22 deaths were younger than 6 months old. So, the next is impact on public health system. Controlling pertussis outbreak requires substantial resources from our public health system. This includes surveillance, diagnostic testing, contact tracing, and vaccination program. We also need to invest in public health, messaging, and education campaign to raise awareness about vaccination, symptom recognition, and seeking timely medical care. So, that's all from me. I'm gonna pass it to the next person.
My name is Farmizaki. I will tell you guys about the treatment and prevention of the whooping cough. The first treatment, they have three: antibiotic, supportive care, then isolation. Antibiotic, they have a three antibiotic that used for whooping cough. First, the azithromycin, clarithromycin, and erythromycin. They are often to prescribe to people with the whooping cough, especially in the early stage of the illness. This antibiotic can help and reduce the severity and duration of the symptom, as well as the decrease the risk of the spreading in the infection to others. Second, we have the isolation. In the effect, the individual should be isolated from others, especially in infants and pregnant women, to prevent further transmission. I will talk about the preventive of whooping cough. They have four. I will explain one by one. First, we have the vaccination. Vaccination is the most effective way to prevent the whooping cough. The pertussis is component of the DAP, stand for diphtheria, tetanus, cellular pertussis. The vaccine is routinely given to infancy and young children as part of the childhood immunization schedule. Booster doses are recommended for the adolescent and adult, including pregnant women during each pregnancy to protect the newborn. Second, herd immunity, that to maintain high vaccination to coverage rate in the community helps create the herd immunity, reducing the overall transmission of whooping cough and protecting those who are too young or medically unable to receive the vaccines. Third is good hygiene. To practice good hygiene is such as covering cough and sneezes, washing your hand frequently with the soap and water, and avoid the close contact with the people who are sick can help to reduce the risk of this spreading of whooping cough. Fourth is post exposure prophylaxis, is close contact of the individual to diagnose with the whooping cough, particularly to infancy and the pregnant woman, maybe give the antibiotic as the preventive measure to reduce the risk of the development of the disease. This is combining of the vaccination with the good hygiene and practice and prompt treatment of the cases can help to control the spread of the whooping cough and protect vulnerable population from the age spontaneously to serve the complication. And last but not least, I want to thank you for joining us with this insightful journey together. Let's make a difference in the fight again with the whooping cough. Stay well, stay vigilant, and until next time, take care yourself.